So my semester project was over the Ranchos Los Amigos level of cognitive functioning scale. So what is it? It is a subjective assessment tool that is used to track the baseline, the recovery, or regression in patients that have had a traumatic brain injury. The first one is usually done on the initial assessment, and it is used throughout recovery to track. All right, so why do we use it? We use it to track responses, emotional responses, and then like the quality and nature of those responses to stimuli. So how do we use it and who can use it? A trained professional has to use it. It comes with a training manual, and then is strictly based off the subjective judgment of the clinician. So you have to have really good subjective skills. And then it can be used day to day to track patients' recovery. All right, so when do we use it? We basically just use it anytime we go in for an assessment to see where they were, where they've become, if they've like regressed, what progress they've made. The strengths is that it can track the patient's recovery process. You can use it at any time. It has been researched and revised, so you know that you're using a good assessment tool for that. And then, like I said, it can be used day to day to track recovery. The weaknesses is that it is subjective. It's not a skill-based assessment, so the patient really, there's no questions to answer. It's not right or wrong, and it's performance-based, and then it may be biased. And then also, like, since it is subjective, it's not black and white. It's a very gray assessment tool. Patients don't necessarily fit into one box or another. They can be in between, or half in this box, half in the other box, just kind of that kind of things. Opportunities is that it can be used by any trained professional, and it can be used at any time. So you can use it every day if you want, every week, or just little progression reports. Limitations is that it does require training to use it, and then you do need very skilled subjective assessment skills. All right, so level 1 is basically the patient is unconscious. They're not responding to any external or internal stimuli. They don't respond to sound, sights, touch, movement, any of that stuff, and they do need total assistance. And then level 2 is they will respond slowly and consistency, and there's no intention to it. And responses include chewing, sweating, breathing faster, moaning, moving, any of that kind of stuff. It's very generalized, and then they still require total assistance. All right, so level 3 is they will respond inconsistently, and the responses will be directly related to the stimulus. So say like you touch their foot and they move, or anything kind of like that. They will respond to familiar people, but it is very localized, and they're still in need of total assistance. And then level 4 is they're kind of waking up a little more. They're very confused, very agitated. They don't know what's happening. They don't know where they are. They have very non-purposeful behavior, and then just a lot of confusion, like I said, and they still need max assistance. All right, and then level 5 is increased consistency when following and responding simple commands. Their verbal and behavior can be very inappropriate to situations. They can perform model tasks, so if you show them something, they can repeat it back to you. And then the memory is impaired, and then they're not learning any new task at this point. And then they are still very aggressive. Level 6 is they can follow simple commands but inconsistently and with a lot of cueing. They can relearn familiar tasks, so like brushing their teeth, like pouring a cup of water, all that kind of stuff. They have a increased awareness of themselves and self-situations. They are unaware of impairments. They have no regard for concerns for their safety. They're just kind of doing whatever. And responses may be correct but inappropriate. And then they still do need some moderate assistance. Okay. Alright, so at level 7, they are very oriented in familiar settings. They are able to perform daily routines automatically and with very little cueings. They demonstrate carryover in learning new things. So from one session to the next, they'll remember what y'all went over. They are kind of aware of their diagnosis, what they have, but they are still completely oblivious to impairments, like all that kind of stuff. Still not really worried for their safety, don't really understand others or like worries for their safety. They do begin to show some interest in social activities in structured settings with like little distraction. And then they require minimal supervision for learning and safety purposes. Level 8, they are very oriented to people, place, time, settings. They can independently carry out familiar tasks in a non-distracting environment still. They are beginning to show awareness in impairments and how they interfere with what they're doing, their daily lives. But they still do require some standby assistance with compensatory strategies. And they are able to use memory devices, that kind of stuff. And then they also acknowledge people's emotional states and will respond appropriately to that. So any of your emotions, they kind of understand like why you're sad, you're angry, all that kind of stuff. And then they are improving in memory and ability to consolidate past and future events. And then they often start to show some depression and irritability. Level 9, they're able to shift independently with different tasks. They are aware and acknowledge their impairments and safety concerns. They are able to independently anticipate obstacles that may arise due to their impairments. And then they continue to demonstrate depression. They're very fast to frustration and agitation. Just get angry very easily still. All right, and then number 10 is they're able to multitask independently. They do still need a little bit of time for compensatory strategies and aids to help cue them to get to where they're trying to go in all environments, really. And then they're more able to make their own decisions, and they act appropriately to other people's intentions and feelings. And then they may still have depression. Every once in a while they'll get depressed. They are still very quick to frustration in stressful environments. Yep. And then they are able to interact with others in social situations appropriately. Yes. All right, and then that's all the skills. Thank you.